Hi everybody. My name is Matt and I'm just here to do a quick head-to-toe assessment on my incredibly fake patient since I don't really have anybody that is willing to or even available to do a head-to-toe assessment on since I'm all by myself here in this house. So I'm just going to walk you through what you would do in terms of a head-to-toe assessment on an adult patient. So obviously the first thing you want to do with any patient when you go into their room is first wash your hands, then introduce yourself and identify yourself and state what you're going to be doing there. So I'd say, hi, my name is Matt. I'm your nurse here. I just have to do a quick assessment. I just got on here. And then I'd ask them to identify themselves, have a little chit chat with them, get to know them, and then proceed on to my assessment. So I'd identify them having two identifiers, so name and birthday, and then I change them into a gown, giving them privacy. Then once they're changed to the gown, I'd come back in the room, close the curtain, and get started. So the first thing you're going to do is, I call it like an ocular pat down. It's really what your general survey is. It's basically where you can assess anything right off the bat when you first walk into the patient's room. So their general appearance, like any type of pallor, skin tone, height, posture, gait, mentation, orientation. All of these can be pretty much assessed when you make that first initial contact with the patient. So I'd start by doing that, and then as I'm doing that at the same time, I'd get a full set of vital signs. So blood pressure, heart rate, temperature, pulse ox, and pulse. And you could even throw in EKG monitoring. Like if you're in an emergency situation, like typically in the emergency room, the first thing we'll do whenever anybody comes in for any type of complaint is we'll just throw them on the heart monitor because they're in every room and it's better to have more information than it is to have less. So once I get them all hooked up to the monitoring equipment and I do my general survey where I've taken their mental status down, and I've just kind of gotten a basic lay of the land in terms of their height and their weight, I then move on to their skin. So again, going from just the top down, I would start by, assessing the scalp, looking for any abnormalities there, looking at their hair, the texture of their hair, if it's brittle, if it's not brittle, note any birthmarks that may be on the skin, and use the ABCD method to assess that type of thing. And then you'd want to assess just their perfusion through their skin color. So you could look for cyanosis, for pallor, for jaundice. You could take a look at their fingernails for any signs of clubbing or capillary refill. And then you want to don gloves and palpate any skin abnormality for texture. So if there's like a rash, you want to see if it's bumpy, if it's not bumpy, if it's smooth, if it's hot, that type of thing. Then you'd move on to your head, ears, eyes, nose, and throat examination. So again, you palpate the scalp, this time assessing the shape of the skull, looking for any deformities. You want to inspect the face, look for symmetry. It looks like I didn't do too good of a job here drawing my guy. He looks like he's a little bit of a droop, so that's not so good. But he's in the hospital. We'll do what we can for him. I'd want to check for perla so that the pupils are equal, round, reactive to light, and they can accommodate. I want to check for extraocular muscle movement, so make sure that they can follow directions and keep an eye on, like follow your finger in all cardinal directions. You want to check for icterus, pallor, and the conjunctiva. Assess the eyeball, iris, and cornea for any type of injection. Assess the retina for the red reflex. Look for papilledema. Assess the optic disc with the ophthalmoscope, just like we did in health assessment. Then you'd move on to the ear canal and look at the drum with the otoscope in the ear canal, looking for any like cerumen impaction. Then you can move on to checking auditory acuity with the Weber and the Rinna test. You'd want to inspect the nose for symmetry and deformity. My guy here clearly has a deformity since he has no nose. That's a problem. So, or it could be an existing medical condition. You never know. That's why you got to ask these questions. So, so inspect inside the nose. You want to visualize the septum, make sure everything is midline. If they have a deviated septum, it could be a problem if you want to throw an NG tube in later. Palpate the sinuses for any signs of pain or crepitus. Then you want to move down to the mouth. Symmetry, color, moisture of the lips, assess for lesions, ulcers, cankers inside and outside of the mouth. Assess the oral mucosa. It should be pink. You want to look for stuff like leukoplakia or any type of like substance that could be like a yeast infection type thing. Inspect the gums and the teeth for good oral care. You want to take a look at just how they're able to move their tongue, if they're able to follow commands, stick out their tongue, and look at their tonsils. You want to grate their tonsils, make sure their airway is clear. Inspect the hard and the soft palates, and then you can move on to the cranial nerves. So I actually found something online that I thought was pretty useful and helped me memorize the cranial nerves. So cranial nerve 2 here is tested with a visual acuity. It's this little man's eyes. It's a little face. So there are his eyes. Visual acuity with the Snellen chart. Cranial nerve 3, 4, and 6 are the cardinal directions of movement. So upwards movement is 3. Lateral movement is 6. Medial movement is 4. Cranial nerve 1 is olfactory. Cranial nerve 5 is the facial nerve. Cranial nerve 7. Cranial nerve 5 is the trigeminal nerve, and cranial nerve 7 is the facial nerve. Cranial nerve 8 is the acoustic nerve. So you're going to test for hearing with that. So you can do like the Rinna test. Cranial nerve 9, you want to take a look at their voice/uvular movement. If they have a hoarse voice, if they have a nasal voice, open your mouth and say ah. 10, you want to assess their gag reflex. So you stimulate the back of their throat very lightly. And then cranial nerve 11, you want to look for, see his shoulders here. You want to look for vesiculations of the shoulder. You could do this from an anterior or posterior position. The video said to do it from posterior, but I've seen it done from the anterior. And then cranial nerve 12 they have here. That wasn't on the face drawing, but, oh, yes it was. I accidentally put it as 11. Let me fix that. Here's 12. Cranial nerve 12. You're going to look for fasciculations of the tongue and just make sure that it's midline and it's not deviating to one side or the other. So then you're going to want to move down to your neck. Here's Mr. Smith's very long neck. You want to inspect and palpate the cervical lymph nodes. You want to look for any masses or unusual pulsations. Assess the trachea, make sure it's midline. Assess the thyroid by having the patient have a sip of water. Then you want to start on the back, the posterior thorax and lungs. So you want to inspect the muscles of the back, symmetry, once again, palpate the shoulders for pain, soreness. Inspect and percuss the chest and lungs in a ladder pattern, comparing both sides. Should be resonance. Diaphragmatic excursion and descent. And then you want to auscultate for lung sounds, again in the same ladder pattern that you used for percussion. For the upper extremities, you can start with the jaw and then move down, which is what they recommended. So you might as well. So temporomandibular joint. Then you want to move to all the joints of the body, assess the range of motion, assess muscle tone, assess strength, check muscle bulk, test the biceps and the triceps, and compare sides. Then you can also take that neuromuscular part and use it to check part of the brain by doing point-to-point movement. So you want to check rapid alternating movements for coordination. So then you want to move on to breasts, which are important for both male and female, but you have to remember that female breast is more dense, so the exam should be more thorough. You want to palpate in a smooth rotary motion, check consistency, tenderness, and assess for nodules. For a female patient, you want to inspect the breast with the patient in a seated position with their arms raised and with their arms on her hips. You want to inspect the axilla and feel for any axillary lymph nodes. Inspect symmetry, size, palpate each nipple, areola, and breast for nodules. So for the anterior thorax and lungs, you want to have the patient supine. And again, percuss, palpate, auscultate, just like you did for the back, and make a note of anything that is abnormal. For the cardiovascular assessment, you want to have the patient at a 30-degree angle. That way you can check for jugular venous pressure with the sternal angle. You want to inspect and palpate a carotid pulse, one side at a time, never both sides, because you'll end up knocking the patient unconscious. And then you want to auscultate for a carotid bruit, palpate the chest, identify the apical impulse, which should be here, on where you would hear for the mitral sounds. And then you want to auscultate with the bell and the stethoscope, aortic, pulmonic, Erb's point, tricuspid, then mitral. You should hear S1 and S2, but make a note of any murmurs, clicks, or gallops. Then you want to lay the patient flat and then assess the abdomen, patient should be, you want to inspect first for distension, hernias, rash, ascites, veins on the abdomen, etc. And then you want to auscultate for bowel sounds in all 4 quadrants. Then you can percuss, and then finally palpate lightly first and then deeply. So you can then palpate the spleen and the liver, and then you can attempt to feel the kidneys, and you should also try and attempt to feel the aorta and the pulse, which is right around the umbilicus, just like Professor Corba taught us. So for the peripheral vascular system, you're going to palpate the femoral pulse, the popliteal pulse on my man's non-existent knees here. Then the inguinal lymph nodes, which are in the groin area. You want to inspect for lower extremity edema, discolorations, ulcers. You want to palpate for pitting edema. Palpate the pedal pulses, again, in my man's non-existent feet. Have the patient stand and assess for varicosities. For the lower extremities, you want to assess lower limb strength, bulk, tone, sensation, and reflexes. Inspect the musculature in both supine and standing positions. Inspect alignment of spine while patient is standing. Inspect the spinal range of motion by having the patient bend over. Inspect the alignment of the legs and feet. Inspect the patient's gait. You know, have them do the heel-toe walk, hop in one place, and then you could do a Romberg test, check for balance. And then moving on to the nervous system, a lot of what we've done already is part of the nervous system that I hit on. So you could do a further mental status exam, just like they did in the video, where you can assess like memory, short-term, long-term, remote memory at this point, if needed. And then the genital and rectal is always safe for last, and you want to highlight patient privacy. For the male, it begins an inspection of the genitalia, the sacrococcygeal, and the perianal areas, palpation of the anal canal, rectum, and prostate. For the female, inspection of the external genitalia and a speculum exam of the vagina and cervix, and then a pap smear and cultures if necessary, depending on the patient's symptoms. And then the practitioner may choose to do a bimanual palpation of the uterus at that point. And then when you want to record it, remember just to keep yourself clear, well-organized, succinct, and neutral professional language. Thank you very much for listening. I know it was a mouthful and I didn't have much to present, but again, I'm all here by myself, and unless you want to see this done on a cat, you're out of luck.